Hello friends, welcome to Fast Coder 21 free medical coding YouTube channel. So always my intention is to share knowledge, gain knowledge. In my channel, you are going to get all the latest updates in the medical coding field, and also you will get latest updates about free APC CU webinars, as well as you will get information about affordable trainings. If you are visiting for the first time, please click on subscribe button in order to receive future updates. So in today's session, we are going to see most common CPT coding blunders needs to avoid. So if you are a surgery coder, or are you planning to write any CPC exam, or if you are planning to attend any interview, this video is very helpful. In order to understand how to avoid these common CPT coding errors, please watch this video until the end. And also please click on like button to motivate me to provide more valuable videos. So first common error is unbundling. So what is unbundling basically? So coding multiple CPT code if you are having the combination code. So if you are having the complete code using combinations, you can't code or you can't separately code individual codes. Most of the time this is due to misunderstanding as well as increased payment approach. But this is one of the most important blunder we need to avoid. So whenever there is a combination code, you can't code individual codes related to that procedure. For example, in CPT, if you take bone marrow aspiration and biopsy, so we are having separate codes for bone marrow aspiration, bone marrow biopsy, and combination code for bone marrow biopsy and up and aspiration. So in the documentation, if the physician performs both bone marrow aspiration and biopsy, you need to code here combination code. Here you can't code individual codes for bone marrow biopsy as well as bone marrow aspiration. So this is the unbundling. So basically unbundling means you can't code multiple CPT code if you are having the pure CPT combination code. So next blunder is upcoding. So upcoding means basically you are coding more than the procedure performed by the physician. So for example, physician has removed lipoma from the subcutaneous level or skin level. So that time you need to code from skin level code. Here you can't use muscle level lipoma excision codes. So basically upcoding means here whatever the physician is performed in the operative report, you need to code that one. So in order to get more payment, you can't code more extensive CPT code. So like if the patient performs only unilateral procedure, you need to code only unilateral procedure. So you can't code bilateral procedure. So this is the one of the most important blunder most of the coder does. So please try to stop this type of blunders. Next one is overlooking NCCI edits. So SIMME has developed NCCI edits in order to prevent inappropriate payment to the procedure performed. So in NCCI table, we are having table 1 and table 2 or column 1 and column 2. So for example, if the physician performs excision of the lesion, always simple repair is included in the lesion excision. So here you can't code the simple lesion repair code. So that time you need to check the column 1 and column 2. You need to prevent here coding simple repair along with excisions. Next one is failing to append the appropriate modifiers or appending inappropriate modifiers. So in CPT coding, modifiers plays a very important role. So based on that modifiers, we are going to provide information to the payer that there is a circumstances where we have used the modifier in order to inform the payer. So in CPT, we are having most of the code descriptions are having unilateral or bilateral. So here, if your code description is having default unilateral or bilateral, here you can't code 50 modifier along with this code. So this is one of the important blunder we need to stop. So next blunder is overusing modifier 22. Usually we will use this modifier 22 for increased procedural services. So each and every time if the procedure is extended or complex, you can't code modifier 22. So in order to append modifier 22, you need to check the documentation, and also physician needs to provide in the documentation that this procedure is took more time to complete because of this condition. So always if you want to append 22 modifier, you need to check the reason for appending 22 modifier. So without documentation, you can't code 22 modifier along with CPT code. So this is also one of the important blunder. So we need to stop it. Next one is improper reporting of the infusion and hydration codes, which are time based. So whenever you are going to code infusions and hydration, always you need to check for start time and stop time. So based on that, you need to code. As all of us know, these infusions and injection and hydration codes are based on time. So here you need to check the time properly from the starting time to ending time, or in other names you can call it as stopping time. So next one is improper reporting of injection codes. So basically injections are per session 1. So you can't code multiple injection during the same session. So here you need to use only one code for the entire session. Next one is reporting unlisted codes without documentation. So if you want to append any type of unlisted code to procedure, you need to check the documentation properly. You need to thoroughly check the CPT book, and if you are unable to find the CPT code only that time, you can append unlisted code. So if you want to code unlisted code, so you need to provide the documentation to the payer so that they can understand that there is no code for this procedure, hence we have coded unlisted code. So always our last resort is to append or code the unlisted code. So if you want to use unlisted code, you need to provide proper documentation to the payer. And also you need to check for radiology codes. So most of the CPT codes are having radiology guidance included. So whenever you code procedures with radiology, you need to check whether imaging guidance is included in the procedure or not, or code description or not. In the operative report, if the physician uses imaging guidance, you need to check for the code which is having the combination of procedure as well as the radiological guidance. So here you can't code procedure with different code and radiology with different code if you are having the combination code of procedure as well as the radiology or imaging guidance. So thank you friends. Thanks for visiting Passcoder 21. If you like this session, please click on like button to motivate me. And also if you are looking for same day surgery training, please contact me at vincentmedicalcoder@gmail.com.